Assalamu alaikum.
Waalaikumsalam, Doctor.
How are you?
Great, Alhamdulillah.
I hope all of you are healthy. Can you hear me?
Yes, Doctor.
How many CC1 and how many CC2?
I'm not sure, Doctor.
So far, 17 CC1, but CC2, we're not that sure.
Hoping inshallah all of you is okay.
Yeah.
Still young and strong. Take care of your health, please. Okay, let us start by Al-Kitab. I am waiting for a case of meconium aspiration from Pecan. Maybe I need to interrupt for some time if the patient came, okay? So let us start by the first case. Who will be the presenter?
I'll be the presenter.
Nakib.
Yeah.
Okay. Who will be the second case?
Arman.
Sorry?
Arman.
Arman. Okay.
Yeah.
So today we have Naqib and Arman. Okay.
So we'll start with the role play.
Yes, please.
Okay. So I'll be the doctor and Shamina will be the mother of the patient. Okay. Okay. I'll start. Bismillahirrahmanirrahim. Assalamualaikum warahmatullah. My name is Nakib, third year medical student of IIUM. So today I would like to ask a bit about your son. So what are your complaints?
My son had fever and rash.
Okay. So when did you first notice that he has fever?
He already had fever for 5 days and rash for 2 days.
Okay. Like before these 5 days, did he have fever before this, or did the 5th day was the first time he had fever?
This was the first time.
Okay. Did you take his temperature at home?
No.
Okay, it's okay. Did he shivers or like roll himself because of cold?
No.
Okay. Did you do anything after you found out that he is fever?
I tried to relieve the fever by tepid sponging. I also used the cool fever, and then I wipe his body with air asam jawa, and I also give syrup paracetamol.
Okay, so does the fever resolve after you did that?
I think no, because he's still warm.
Okay. And I would like to know if the fever come and go in these 5 days, or does the fever continue until today?
It is persistent.
Okay. And did you notice anything different with his behavior? Is he active before?
He becomes less active.
Okay. Is there any fitting episodes with the fever?
No, no
Okay.
fitting episode.
Okay. Is there any associated symptom like cough?
He also had cough, but I think it is due to cold.
Okay. So the
Cold
cough.
environment.
Okay. So the cough. Is there any sputum produced from the cough?
No sputum.
Okay. And is there any blood come out after the cough?
No.
Okay. So but what is the sound of the cough? Is it sound like a seal, maybe?
No, it is like usually cough.
Mm-hmm. And did he make sounds like whoop sound after he cough?
No.
Okay. So does he have a runny nose or rapid breathing or anything problem with his breathing?
No.
Okay. How about his ear? Any ear discharge?
No.
Okay. Does he vomit during these
No.
5 days? I don't know. Okay. Any diarrhea?
No.
Okay. So
No
did he
diarrhea.
did he contact with any positive COVID-19 patient?
No.
Okay. Did you brought him to any klinik kesihatan to check for this problem?
I brought him to klinik kesihatan on the first day he had fever.
Okay. And then what did they do or they give?
They take the temperature and it is 37.1 degrees Celsius. And then they do the rapid, the RTK test, and it turns out to be negative. So they give paracetamol, syrup paracetamol.
Okay. So and then after he took the paracetamol, is it relief the fever? Still no.
Still no. Still the
Okay.
same.
So other than that, regarding the rashes, I would like to know about the rashes. So where and when did the rash start?
I start to notice there is rashes at the face first. On the third day.
On the third day. So has the rash spread to other side?
The next day it spread to the trunk and then to the buttocks, genitalia, and then to the upper limbs, but there is no rashes at the leg.
Okay. So what is the characteristic of the rash? Like, is there any nodule or any bump noted on the rash?
I see the rashes red, and then there is like small spots.
Okay.
And it is also itchy because he always rub at the rashes.
Oh, okay. Did you touch the rash? Like, is it fade when you touch them?
I don't touch them.
Okay.
I don't notice it.
All right. Does the side of the rash swell? Any swelling at the side of the rash?
No.
Okay. Did you check his mouth before? Because I would like to know if there is any white spot spotted inside the mouth.
I don't notice any white spot.
Okay. So did you do anything to relieve the rash?
I bring him to the private clinic when he had rash, and they give another syrup paracetamol and calamine cream.
Okay. So how the rash is now? Is it resolved with the calamine cream?
Right now it already little bit fade away.
Okay. So did you live in the dengue prone area, or is there any outbreak in your neighborhood?
I'm not sure, but the last fogging is at the end of the year, the past year.
Oh, okay. Other than that, I would like to know if he had any trouble with feeding. Is there any reduce in feeding?
He had
Okay.
reduced in feeding.
Okay. Like normally, how much did he feeds and how reduced is it?
Usually he would take about 3 ounces of formula milk for 3 to 4 times a day. But when he was ill, it was reduced to one ounce.
Okay. Is he as exclusively breastfed or together with formula milk?
Together with formula milk.
Okay. Did you change the formula milk before?
No.
Okay. So other than that, is there any excessive thirst for the patient?
No.
Excessive thirst? No. Is there any? Did you see any like he become paler? Any sunken eyes?
No.
Okay.
No.
How about the urine output? Is his urine output is normal? In any reduced
No.
urine output? No.
No.
Okay. Did you notice any bleeding on his gum or any nosebleed?
No.
Okay. Is there any weight gain or weight loss noted?
I think no.
Okay. Did you notice any changes with the color of the stool? Any
No.
blood noted? No. Okay.
No.
Did you notice any changes in the color of the urine? Any blood or frothy urine?
No.
No. Okay. So I would like to know about the Vikri medical history. Is this his first time being admitted to hospital?
This is the first time.
Okay. Has he undergo any surgical procedure before?
No.
Okay. And then I would like to know about his immunization history. Did he vaccinated follow the national immunization schedule?
He follows the
Is there any side effects after the vaccination?
No. No side effects.
Okay. So were there any obstetric problem like gestational diabetes or hypertension when you pregnant of him?
When I pregnant, I had GDM.
Okay. Did you take any medication during the pregnancy?
No, on diet control only.
All right. Were there any concern during the delivery or intervention required to deliver the baby?
I delivered through cesarean section because of the poor spacing. But everything is okay. But he was preterm.
Oh, preterm. What was his gestation and birth weight?
He was at 35 weeks and the birth weight of 2.5 kilogram.
All right. After he was born, did he admitted to any special care baby unit?
He was admitted to NICU.
Okay. For what reason?
He had because of the preterm. And he also had prolonged jaundice for 1 month, but doesn't need any phototherapy.
Okay. Next, I would like to know about his nutritional history. Is at what age did he weaning?
He start weaning at 6 months old.
Okay. At what kind of food he usually consume?
I introduced him with porridge, Nestum, and soft biscuits.
So any allergies to those foods?
No.
Okay. And next, I would like to know about his developmental history. Can he crawl and stand with support?
Yes.
When you give him something like toys, can he grab it?
Yes, he can grab it.
And can he like say a word like Baba or Mama?
He can.
Okay. And then how many siblings does he have?
He had 1 elder brother.
Okay, how old is he?
2 years old.
Did he have any medical illness?
No, he is healthy.
Okay. And I would like to know how old are you and your husband?
We are 32 years old.
And do any of you have any medical illness?
No.
I'm sorry, but I need to ask this. Is this a consanguineous marriage?
No.
Okay. Is there any malignancy running in the family?
No.
Okay. I would like to know about the social history. What is your husband do for a living?
He worked as an army.
Okay. How about you?
I work as assistant pharmacy here.
So on average, how much your husband and you make per month?
About 5,000 per month.
Okay. So does your place have clean water and electricity?
Mm-mm.
Yeah. Okay. When you guys are working, who take care of Zikri?
Um, I send him to the caretaker when we are working.
Okay. I think I got all the information, so I will proceed to physical exam after this. Thank you. All right.
So,
Can I continue, Doctor?
no. Just to make summary.
Oh yeah, the summary. So Zikri, 8 months old Malay boy, was brought to Susmek, department of Susmek, due to persistent fever, rashes that begins on face and spread to trunk and extremities, reduced oral intake, and lethargy. There was an occasional cough, but resolved on day 1 of illness. Upon admission to and then the dengue rapid test was done on I think that's all.
Okay, just I would like, I inform your mother of the patient, Shamim, that I am going to ask you about the flow of the examination. Did you inform them, Shamima?
I'm sorry, doctor. Come again.
Did you inform them that I'm going to ask them about the flow of the exam?
I already informed them.
So now just tell me if you are going to exam any skin rash, how you make your own flow now?
Me, doctor?
Yes,
Okay. So, Abed, what's your question?
you didn't hear to me before?
Yeah. I didn't hear clearly the question.
Okay.
Uh,
How is your flow to exam the skin rash now?
the skin rash.
Yes.
First, I will on as general exam. I will look at the hands to check for the rashes. If it's a macular rash or macular papular rash, and I will check for the diameter of the rash, and I will press the rash if it's blanching or not.
Good. What is the meaning of unblanching?
Non-blanching means there is bleeding underneath the skin.
What's the name? Scientific name?
The
If you press over a rash and it doesn't disappear, so it is Anis.
Purpura, doctor.
Yes. Okay. After that,
and then still on the rash, or
it's still in the rash. Okay, this is the most important point. I didn't want to challenge you, but I need all of you to have your own sequence for examination. Because if you are not systematized, you may lose an important sign which can make difference in our diagnosis. So number one, if the family come to you and ask if there is rash, as you said, number one, I would like to know how is the type of the rash. So Faiz,
So what to know about the rash? We can
type.
where type.
Yeah,
The
babule and babule. What else?
I'm sorry.
He said it can be macule or babule. What else?
Macule, vesicular.
Like
Such as in measles, there's this pus.
measles is vesicular? No. Common disease with vesicular skin rash. Is the chicken
Chickenpox.
or
Varicella zoster.
herpes simplex also. So it is very important to know, is it a macule, papule, vesicule, or is it black according to the size and like that. Number two, we must ask ourselves, how is the distribution? I mean by the distribution, is it central or peripheral? Is it all over the body or not? Type of centripetal rash is, centripetal, يعني more in the center. It's the same one, it's the chicken pox. You will find some rash inside the abdomen, and it is a matter of luck to find a lot outside or not. That's why many patients may be missed. He has this rash, but the mother said it may be some urticaria and it can gone and not diagnosed. Okay, so it is or more in the face, like the measles. The measles rash will start by upper. Do you know the distribution? Will start from the face and like a short curtain, it will come down. When it disappears from the head, it came to the leg, and after that, it disappears. So it is very important. Okay. So this is number one. Is it symmetric or asymmetric? Because if it is asymmetric, I may consider typical case. The most important point, now I'm speaking about the skin, yes? But there is an important thing known as skin appendages, which is number one, the mucous membrane, and even the tooth and the gum, and even the eye, and even the anal orifices or genital orifices. All this. Why? Can you tell me, Shazwan, one more? One more. what is important disease that can affect the mucous membrane? Who can?
Kawasaki, doctor?
Measles, doctor?
Kawasaki is what else?
Measles?
Measles can affect the mouse, but not other mucous membrane. I mean, specifically can affect the eyes, mouth, genital.
Herpes simplex.
Can be, but we have a very dangerous disease known as Steven.
Oh, Steven Johnson.
Steven Johnson sometimes is life-threatening. So after I finish the skin, I will ask myself, what about the mucous membrane? It may be affected and I need to take decision because it is sometimes very, very, very severe. This is number two. Number three, I must ask myself also about the hair. Is there an affection of the hair because some area can affect the scalp like that? It is very important. What about the nail? Some rash can affect also the nail and it can guide us, especially for some rheumatology. And then I will ask myself, how is the history? As I told you, distribution, some rashes may came to the center of the body and goes like the New Year tree or the birthday tree, like that, can affect. But I must ask myself, what other manifestation accompanied this rash? Okay. Is there any, as your colleagues speak, it affects the eyes for conjunctiva, can be Kawasaki or not? Is there any lymph nodes? Okay, is there any edema? Is there any peeling? Is there any characteristic feature like slapped face? Okay, which is an important disease. Okay, if it is a child look very red and got few days of fever and then establish the rash, I will start also by what disease? Fever, fever, fever for 3 or 4 days, and when the fever drop, the rash appear. It's a very famous phantom, very good. So you must know, which is known as the fifth disease. Before they are arranged, what is the first? Is it measles? What is the second? It is rubella, and then fifth and the sixth disease. You must go all through that. So if I found any rash in front of me, I must ask. This for some cases, but for the other cases also, I must be wonder. Because rash, I think it may be with time we know that some doctor is only specified on rash, subspecialty. Because rash can be a part of systemic disease. Did you agree, Aiza?
Yeah, I think so.
Give me an example.
Of systemic or
Systemic lupus erythematosus or dermatomyositis, juvenile chronic arthritis can be presented by Salmon rash. A lot, if you open, it is unclosed issue, but at least you must know the common. So it is very important while I am thinking, it is not just a simple rash, can be urticaria for anyone, or some of doctors said that the dermatology is deep subspecialty, neither cure, neither treated, neither it is a bit ignorance, okay? It is a very important. If you get a look to the skin and then get a look to the body as a whole, okay, with some details about the history, you will find your computer have a lot of varieties, a lot of diagnosis and differential diagnosis. So what's your diagnosis now, Naqib?
The provisional diagnosis?
Yes,
Dengue fever.
dengue fever.
Yeah.
So can you tell me how many stages of
The phase, dengue fever, 3 phase,
cheese?
which is febrile phase, critical phase, and convalescent phase.
So if you have the knowledge, tell it from the start. It is your chance now to speak with the knowledge which you know. Just to continue in 3 stages, which blah blah blah. Which one is more dangerous?
The critical phase.
Very good. Now, what is the causative organism for dengue?
The dengue virus, strain 1, 2, 3, or 4. It is an arthropod borne, transferred by the mosquito, which is Aedes albopictus or Aegypti.
Okay. So, is it for strain? If I got infection of the strain, I will be immunized against the others or not?
No. You can have the secondary infection by a different strain virus, dengue virus.
Anyone need to add? Because it is very important how to communicate with the family. Yes, you can add, but sometimes it is more severe. If you got another infection, so someone told you, oh, okay, I came out, I played games and do everything and good dengue, so I will continue my life now. No. Sometimes it will come to be more severe, like hemorrhagic or shock. Okay. So can you tell me your full diagnosis now?
So it is dengue.
Or you must choose one.
It is dengue fever. Dengue fever in febrile phase.
Is it enough?
Uh,
Or Afriana can add?
Sorry, my line was terrible just now. What was it again?
How to put complete diagnosis for a case of dengue fever?
Oh,
First, he told us.
so
Then he said, isn't dengue in convalescent stage? Can you add more? Which is very important.
with or without warning signs.
So I need to define, is it simple dengue or dengue with warning sign or severe dengue, which may be hemorrhagic or shock? So which stage is it, Naqib, now? Is it simple or warning or
with a warning sign due to the patient is lethargic and the patient have the lab result shows that the patient is leukopenia and thrombocytopenia. So dengue with a warning sign.
So Nurian Anis,
Yes, doctor.
what warning sign do you know?
Warning signs in dengue have 6. One is intense abdominal pain or tenderness. And then second is persistent vomiting. Third is clinical fluid accumulation. And then next mucosal bleed. And then lethargy and restlessness. And then the last one is liver enlargement more than 2 centimeters.
There is another warning sign can be detected by lab. What is it?
Is it leukopenia? Oh, no. Increase in hematocrit with concurrent rapid decrease in the platelet count.
So how much is the cut point for the hematocrit?
I'm not sure for that. Wait.
Below if uh, mm,
So if it is more, is 40 or more, it is a dangerous. Okay.
mm,
Why? Naqib.
uh,
Now the knowledge is in the brain, not in the book.
Is it because we scared that patients might have like shock because of the thrombocytopenia,
oh,
hemorrhagic shock maybe?
No. Yes, shock is different. Now, if hematocrit is high, there is probability for thrombosis and like that, which is very dangerous. Okay, because the cascade of disturbance which can happen are very, very dangerous. So take care. It can bleed. It can cause like clotting, coagulation. So we must be very cautious. Okay. Now, Aiza,
Yes, doctor.
there is a bedside test can be done for the dengue cases just to know is it bleeding tendency or not. Do you know it?
Test.
Yeah, clinical test.
Tourniquet test. Is it? No.
What is the name?
Is it the tourniquet test? I'm not sure. Yeah, tourniquet test.
What is the tourniquet test?
Based on what I remember, it's they put the cuff and inflate it between the systolic and diastolic blood pressure of the patient, and then they calculate the uh, the amount of rashes on the on certain area, but I'm not sure how it was done actually.
Who can support Aiza?
I think what Aiza told is already correct, but like we can count the PTK more than 20 is considered positive in the dengue. It's like more than 20 PTK per 2.5 centimeter square area.
There, 2.5 or 5 centimeter?
From what I read, it said 2.5 centimeter square.
What's your opinion, Naqib?
yes, sudah.
How big is the circle?
How big is the circle? Uh, like she said, the diameter is 2.5 centimeter.
Is it half diameter or the complete diameter? Okay,
So,
let us see your preparation after that. You must revise it. It is very important because dengue fever, as some others, disease which is endemic in Malaysia, you don't have any excuse not to know from A to Z. So just tell me by title, what is your differential diagnosis, and we will leave it to the presentation after that without.
okay, so my differential diagnosis is first is measles, the next one is rubella, and last one is scarlet fever.
Anything else?
Other than that is can be hmm, can be chikungunya.
Why you didn't write it? What else?
How about Zika virus?
Zika, okay. Japanese is not so far for us. Yes.
And then
There is one disease can occur here in our area, and the rodents like ticus.
leptospirosis.
Is it endemic disease?
Mm.
Yes. In
Yes.
some areas.
Mhm.
You mustn't forget it.
Yeah.
What is the difference between lepto and the dengue in the rash itself? In the clinical examination, you must be able to be ready to answer. Can you? Because your face must be to us, not to the computer.
Ask about leptospirosis.
Yes.
Have you traveled? Have the patient do any water sport activity?
Okay.
Is there any rodent infestation in your residence?
Okay.
And then like is
Afriana.
Mhm.
Frina. Are you around, Frina?
Yes, I'm around. But the audio was lagging all the time just now.
Any other clue for lepto?
What? The history to water recreational area.
Okay, he informed about that water and
Oh, okay.
infestation. What else? Anyone knows? Something in the eyes?
Conjunctivitis.
Yes, non-virulent conjunctivitis is very important. What else? Something in the abdomen.
Jaundice.
Yes, abdominal pain and transaminitis. It is very common. In spite, it can occur also with dengue, but it is very common with leptospirosis.
leptospirosis.
Okay, so you must be able to answer the question. All of you, I think the university updated for us the up-to-date. You can open over it now and you can just write fever and rash in children. It will tell you that your computer must be engaged with a lot of cases, but at least you mustn't miss the important and common and endemic one. Okay? Anyone knows about enterica? Some area in Malaysia here got epidemic of enterica before, a few years ago. Anis?
Yes, doctor.
It's typhoid fever or enterica. Is there any something specific for it?
Intrica.
Typhoid and paratyphoid. So it's very important because
Diarrhea. Diarrhea, abdominal pain.
Okay. Hemorrhage, yes, what else?
History of eating outside food.
Okay, what else?
Um, a loss of appetite.
So it is very important. What is the type of rash here?
Rose spots.
Yes, rose spots are very important. Okay, what is the type of fever? If you make,
The fever, high grade fever.
it has now, if you come to the hospital, inshallah, hoping you will come soon and just write the vital sign of the patient and ask for the trend. They will give you charts for the fever. How it will
Okay.
appear in case of enterica? It is known as
Sure.
state ladder. 7.5, second day 38, then 38.5, then 39, then 40, like that. So it's
Okay.
state ladder, which are very important to know the significance of the temperature chart.
Okay.
For malaria, malaria can come with rash, also with fever. So did you ask about, is there any travel to area with malaria, or if there is an area here in Malaysia with malaria or not? It is very important. And its temperature looks like what, Naqib? Malaria. Contagion fever. So it is very important to know. It will come at certain sequence when destruction, and it will come with jaundice and like that. So please, you must know A to Z for malaria and for other endemic disease like chikungunya, like leptospirosis, but you must know their differential diagnosis and the most and the top important point for that. Am I clear? And you must know also how to examine so you can pick the other diagnosis. Okay, can you continue for your presentation?
So I'll continue with the OSCE question.
Okay.
Okay, so the first OSCE question is an 8-year-old boy was admitted to the hospital with a 4-day history of high fever, headache, and malaise, and a 2-day history of epistaxis and hematemesis. He has been diagnosed with severe dengue. So the first question is, what are the criteria of severe dengue? Anyone want to answer?
I guess some of the criteria for severe dengue is severe plasma leakage, and then there's severe organ impairment, as well as severe bleeding.
Okay. Okay, that's correct. And can you list the serotypes of dengue virus?
So dengue 1, 2, 3, and 4.
Okay. Next slide, please. Okay, so that is the answer. So the criteria is severe plasma leakage, severe bleeding, and severe organ impairment. And the serotypes are dengue virus 1, 2, 3, or 4. Next question.
So it is very important to come back, please. Here, the plasma leakage, it is an important mechanism which can end by death if you didn't diagnose and take care about it. Okay, so the patient can go for shock gradually. That's why if the patient, we found him, his capillary fill time started to be affected or like that, we must give one normal saline bolus. If not respond, give the second. If not, you must go and do support for the respiration. You must intubate, okay, because the patient may collapse anytime. So take care, please. Okay.
Okay.
Continue.
Okay. Next slide. Okay. This is the second question. So the first question is describe the rashes. Anyone want to try?
Phase.
Describe the rash. It is an island of white in a sea of red.
Okay, and what is your diagnosis and which phase is the disease?
Dengue fever currently in phase critical phase.
Okay, and can you give two complication of the disease?
Shock and organ failure, multi organ failure.
Okay, next slide, please. Okay, so that is correct for the first question. Island of White in the Sea of Red, which is the one of the typical findings for the rash for dengue fever, and the diagnosis and phase, it is dengue fever, usually in it can be in the effervescence phase, and it also can be in the febrile phase. And the two complication, it can be shock and multiple organ failure. I think that's all for the OSCE question and for my presentation.
I think you must do better than that, Naqib.
The OSCE question?
What is the test which needed to diagnose the dengue?
A dengue rapid combo test, which is the check for serological test for IgG, IgM to dengue virus.
What else?
Check for NS1 test.
When is the timing for it? Consider NS1 or IgG, IgM.
So the timing for, like, if the patient have history of fever that less than 5 days, we can check for NS1 antigen and rapid combo test. If it's positive, it is an acute dengue infection, and if it's negative, we need to do the dengue test after the patient have fever more than 5 days. And if after 5 days, we do the serological test and the IgM is positive, it means it is a recent dengue infection. And if it's more than 5 days and fever and the IgM or NS1 is still negative, we can do we can check for the IgG. If elevated IgG means it is dengue infection.
IgG means the dengue infection.
After 5 days history of fever, and if the NS1 and IgM is negative, we can look at the IgG.
Usually IgG means there is previous infection. Okay. IgM is current one. So if I found the IgG, mean I got an infection before. But for the recent, one is IgM.
IgM, yeah.
That's why all of you must know about the difference between IgG and the IgM generally. It's very important, and all of you need to read the pediatric protocol and the one topic of up to date in dengue and its differential diagnosis. Okay? Just a minute, I will get a look for one patient and come back to you. Assalamu alaikum. Okay,
Waalaikumsalam.
the second case.
Okay, I will proceed with case number 2. I'll start with the role play. With Faiz. Assalamualaikum. I'm Arman, year 3 medical student. Today, I would like to ask something regarding your child. Is Assalamualaikum, Faiz.
Oh, I'm here.
Okay. Assalamualaikum.
Waalaikumsalam.
I'm year 3 medical student, Arman. I would like to ask something regarding your daughter, Aira.
Okay.
Okay. Firstly, why do you come here?
Oh, I come here because she has rapid breathing, doctor.
Rapid breathing. Since when?
During the day she came here, during the day of admission.
Oh, so did she experience any cough?
Yes, doctor. Just one day prior the rapid breathing occurs, doctor. She has cough, doctor.
How was that cough?
It's a chesty nature and occurs intermittently.
Oh, so was there any sputum production?
Not sure, doctor. No, doctor.
Okay. Was there any prolonged bouts of cough?
I think no, doctor.
Okay. So the cough worsened at any time, at the morning or at the night?
As far as I know, no. It continuous regardless morning or night.
So do you hear the cough sound? How was the cough sound? Was there any like whooping or barking sound?
No. As far as I know, no. There's no barking sound. No whooping sound.
So did she experience any choking or drooling of saliva?
No. She has no history of choking.
Was there any history of fever before?
As far as I know, no, doctor.
Any vomiting, diarrhea?
No.
Did she experience any runny nose or
no runny nose?
No discharge the nose?
No.
Okay. Did Aira feed normally? Was there any difficulty of feeding, like she didn't want to breastfeed or didn't want to eat food?
Yes, she has a reduced oral intake, doctor, because usually she eat about 1 bowl of porridge, but during the day of rapid reading, she lessened only half of the bowl, doctor.
Oh, so there is a reduced feeding.
Yes.
So how was her urine output? Is it normal like before?
I think yes, doctor, because usually there's a reduction because usually I change her diapers around 6 times per day. However, during the day she went to the hospital only 2 times only. I changed the diaper.
Okay. So do you notice any frothy urine or any change in color or smell of the urine?
No, doctor.
Okay. So do you see her mouth? Did her mouth dry?
Her mouth, no dry mouth.
Was there any sunken eye and reduced in tears?
No, there no reduction of tears. She cried a lot during the day of admission, doctor.
Okay. Okay. Was there any family members that got sick before?
I think no. All of us are healthy, doctor. No fever.
So did Ira go somewhere else and contact with anybody else at the outside?
Excuse, pardon?
Did Ira go contact with someone else outside other than family members?
Yes. Yes. When my husband and I work, we deliver her to her caretaker. And I noticed that her caretaker has a 2-year-old child, and noticed that her child had fever on the same day.
Oh. So the child at that have symptom.
Yes, doctor.
Okay. So do you notice any COVID cases around your house? Did Ira contact with any COVID cases before this?
No contact COVID, no contact COVID cases.
Okay. Do you travel anywhere before this with your family?
No recent traveling history, doctor.
Okay. Was there any shortness of breath or difficulty to breath? Do you notice on the Ira?
Yes, during her admission, doctor, I noticed that she breathing heavily, rapid breathing, have shortness of breath, doctor. And also when she tried to inspire, doctor, there's noisy breathing, I noticed.
Was there any noisy breathing?
Yes, when she trying to take in her breath, doctor, during inspiration.
Do you notice any recession anywhere around her chest?
Yes, I noticed that she has some sort of chest indrawing, doctor.
Oh, okay. Had she experienced the same episode like this before this?
No, this is her first, doctor.
Okay, so how was she on that day you noticed that she has rapid breathing? Does she active like usual or lethargy or?
No, she less active than usual, doctor.
So after that, what do you do? Do you go to any clinic?
Then I went to uni clinic one time, doctor, and then the doctor referred her immediately to the emergency department in Suspect.
Okay. So do you notice any head bobbing?
No.
So do you notice any bluish color in her face, her hands, or her lips?
No.
Okay. So do you have any family members who suffered from allergic condition like allergic rhinitis, eczema, or asthma?
No family members except her uncle, doctor. My brother, she has bronchial asthma.
So what? Does her uncle is on medication for the asthma?
Yes, he is on inhaler.
Okay. So I would like to ask the past medical and surgical history for the Ira. Has she ever been hospitalized before?
Yes, doctor. This is her first hospitalization. Her first hospitalization was diagnosed because she have short bowel syndrome, doctor, and required surgery 2 weeks after her birth.
Oh, 2 weeks after her birth. So the Ira, I would like to ask about the drug allergy history. Did she take any medication?
As far as I know, there's no prescribed medication, doctor, aside from she has on vitamin, but I can't remember the name of the vitamin, doctor, for her short bowel syndrome.
Okay. So did she has any food or drug allergy?
No drug, no food allergy.
Okay, I would like to ask a little bit regarding the birth history. When did Ira was born?
She born in.
Okay.
In the hospital. During when I was pregnant, she was normal. However, during her 6-month medical checkup, she noticed that she has bowel problem on the scan. Aside from that, I have no diabetes, no hypertension, doctor.
Oh, so you have no medical illness?
Uneventful. However,
So
during want to deliver the baby, I need to underwent cesarean section, doctor, because I have leaking like what at 36 weeks of gestation.
Do you remember her birth weight at that time?
2.2 kilogram.
Okay. After she was born, did she experience any jaundice after that?
She had neonatal jaundice, but I think this does not require any phototherapy.
Okay, so I would like to ask about the immunization history. Is she already being immunized based on the national immunization schedule?
Yes, doctor. She immunized up to her age, follow the schedule, no complication, no fever, no rash.
Okay, so I would like to ask about the nutrition history. When did she start breastfeed?
She was exclusive breastfed until 3 months, and then she start formula milk.
So now she is on breastfed or formula milk alone?
Both, doctor.
Both. So how many times she consumed the formula milk and how much every time?
She consumed 4 ounces of milk 3 times per day. We
What
use Similac and Dugro.
Okay. So when did she breastfeed? Like what time in the day?
Only it doesn't.
You say that she is still on both the breast milk and formula milk, right?
Yes.
So how much did she consume breast milk when you were at home?
Oh, I use it around 50 minutes. However, during the day emissions, only 2 minutes, doctor.
Okay. So when did she start weaning? And what
6
did
months.
she eat?
6 months old, eating porridge.
How many times per day?
Three times, doctor. Morning, lunch, dinner.
So okay, I would like to know a little bit regarding her development. So now, what she can do? Like, can she stand, crawling?
Yes, she need to pull herself out to stand, and she can crawl.
Can she grab object when you give like toys to her?
Yes, she stretch up to look for toys.
Can she talk like word baba or mama?
Yes, she can babble, baba, mama in single syllables.
How is she socially? Like, can you carry her easily?
Yes,
and can he
she's
talk
very
to strangers?
She's friendly with strangers.
Okay. So I would like to ask about family history. Does she have sibling?
Yes, she is the second child. Her sister is 3 years old.
Does her sister have any medical condition?
No non-medical illness.
How about you and your husband? Any medical illness?
No, we both are healthy. My husband and I are healthy.
Is this a cross-engineers marriage?
No.
Okay. Is there any non-medical illness runs in your family side, like your side or your husband?
No.
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 Okay. I would like to ask about social history. What is your and your husband did for a living?
We both work as a police officer.
Okay. Can you share with me about your household income?
Around 7K.
Okay. Where do you live?
Sungai Soy.
How is condition there? How about the electricity or the supply? All good?
Yes, it's normal. It's okay.
Does your father smoke?
Yes, he smoke. But I only smoke in the office.
Okay. I think I got all the information I need for Ira. Thank you.
All right, doctor.
So can you do simple summary?
For the summary, my patient Ira, an 8-month-old Malay infant with underlying shock bowel syndrome, presented to emergency department of Sultan Ahmad Shah Medical Center, Sasmet, due to rapid breathing on the day of admission. It was associated with chest ingrowing and noisy breathing. She was also lethargic, less active, and irritable, as well as having reduced oral intake on the day of admission. Her urine output was also reduced. Otherwise, there was no dry lips or bleach discoloration noted. Upon further history, she experienced on and off dry cough one day prior to the admission. On physical examination, there was Subcostal recession noted. Vesicular sound with bilateral ronchi was seen.
So what's your working diagnosis now?
So my my provisional diagnosis, I would like to say the acute bronchiolitis, because the IRA in the infancy age has history of sick contact at the care center, have chesty cough, have rapid breathing, noisy breathing, subcostal recession, also ronchi on auscultation. But the points against this provisional diagnosis is IRA did not develop any fever, and there is no fine end respiratory crepitation in the IRA.
What is the causative organism?
Yes.
The causative organism?
For the acute bronchiolitis, one of the common is RSV, respiratory syncytial virus.
What else?
Usually below 2 years. The peak is around 1 to 6 months.
Other viruses?
Other viruses, we have
the one who is not using, is Mike, please, of it.
the virus that can cause acute bronchiolitis. We have myxovirus, adenovirus, rhinovirus and human metapneumovirus.
Okay, there is some categories known to good severe attack of bronchiolitis.
Yes.
There is some cases or some diseases or some patients, they can get RSV virus very dangerous.
Adenovirus. Okay.
Can I be good bronchiolitis by RSV virus?
For what complication?
No, I am asking you, there is some patients or some clinical cases, if they get RSV virus, they will be very, very, very severe.
The name of the complication?
The disease will be severe, even need intubation. And
bronchiolitis obliterans.
Okay, what else?
Is a rare complication of the bronchiolitis. It causes permanent damage to the airways.
Yeah, another disease. Anyone knows? Let us start by another way. Is there any vaccination for RSV virus? Anyone knows?
No, there is no vaccine for RSV.
Sorry?
There is no vaccine for RSV.
You mean no obligatory vaccine?
Yes.
But there is, but not obligatory. Do you know it, one more? Blavizumab. Blavizumab. It is very, very important RSV virus vaccination, which are restricted to about 4 groups. Number 1 is the premature or preterm baby. Number 2, congenital heart disease. Number 3, immune deficiency and cystic fibrosis. All this, if they got RSV, usually they are very, very, very affected and they may be end by intubation. That's why there is now, we are giving for every preterm baby, we can give him Zumab. Okay, it is very important. So what is the treatment for bronchiolitis, RR?
We can give the supportive and pharmacological treatment. For the supportive, we can give the oxygen, the oxygen through nasal prong, also, we can give mechanical ventilation sometimes, but it's very rare. We can give intravenous dripping if there is difficulty feeding or dehydration. And we also need to monitor for apnea if the children is below 4 months. And we always monitor the pulse oximetry to maintain the blood oxygen, and also monitor for the sign of tachypnea, tachycardia, and dehydration.
Okay, what investigation do you need to do?
We need to do the full blood count to see was there any infection the organism, and we can do the pulse oximetry to see the oxygen. If we do the pulse oximetry, we doesn't need to do ABG, but we do ABG in severe cases. Like we very need to know the extra blood test. So we also can do the X-ray to see the sign that we can, the lung fluid sign. Usually for the acute bronchiolitis, we can expect to see the hyperinflated lung on the X-ray, and we can see the flattened diaphragm, horizontal rib, and sometimes if there is a segmental collapse, atelectasis occur, we can see the occasional scattered area of consolidation. So we also can do the nasopharyngeal secretion to detect organism.
Yeah, this is an important test. I think it is not available, but it is as a routine here, but it is available. Just a nasal swab for RSV or influenza. Now we have about RBB, which is the respiratory panel, can detect more than 30 virus and some bacteria also. Just a swab, like that of the COVID, just a swab for the nose, it can guide for the diagnosis. So bronchiolitis is a very common, but if you say this patient came with wheezes and respiratory distress and like that, so it can be asthma?
Yes.
Can be bronchial asthma?
The patient doesn't have the symptom of asthma, like the worsening of the cough at the night and at the morning, and then there is no known allergy history in the era.
What else?
Era also doesn't have wheezing. Wheezing, and
what else? Phase?
Yes.
Phase.
Is there any symptom during UITI, such as coughing, wheezing, heavy breathing, family history? And then look for number as a exacerbation per year, how many times? Maybe we can say that she has asthma. Because as far as I know, it's below 5 years old, it's hard to diagnose.
Yes, they're very important. not diagnosed for this young age, but there is some abbreviation known as API. What is API? API. Asthma predictive index. Anyone knows? Aiza, what is asthma predictive index?
It's a method where we determine the possibility of patients to develop childhood asthma, is it?
Yes. So what is the criteria?
History of wheezing, episodes of wheezing, parents with or history with asthma or eczema, allergic rhinitis, and criteria.
Who can arrange the criteria? Who else? Anis.
Yes. The criteria is divided into major and minor. The major criteria is parent with asthma, atopic dermatitis, and also sensitization to at least one allergen. Minor criteria is wheezing, unrelated to cold, blood eosinophils more than 4%, and sensitization to food allergen. And the index is positive when children has at least one major criteria or two minor criteria.
From where is this voice coming?
I think it's Arman's roommate.
Who is this? Is it a medical student? If we hear their voice, we will pick their name again. It is not acceptable. Arar, we are in class now. For any score, you must have, and concentrate in this, please. For any score, we have STEM and criteria. Okay, so the STEM here will be the patient got at least 3 attacks of wheezy chest within 12 months, plus either one major or two minor. Okay. If we came already to the rheumatic fever, anyone knows John's criteria?
Major and minor.
Yes, no, it is not only major and minor. I just
And also positive culture for group B.
recent history of streptococcal infection plus two major or one major and two minor. What is that? So I need one of you collect the score, this criteria for rheumatic fever, for Kawasaki disease, for subacute bacterial endocarditis, for API. Who will do it? You will find every score has a stem and then some details. Anyone will raise his hand, so he will be favored. or should I choose?
We already have the seminar doctor for rheumatic fever.
Not rheumatic fever only. We have a lot. But in seminar, we are speaking about seminar now. Okay. Who will do this course?
I can do the. You mean the compilation of scores for all the diseases? Is it?
The most common one. Okay. Afriana, okay?
Okay,
Afrina,
doctor.
sorry. Okay, go for your presentation, Aral.
Okay. For the differential diagnosis,
Yes.
next slide. Okay, for the differential diagnosis, I will put the pneumonia with bronchospasm. The point for this differential diagnosis is that also the infancy age, history of sick contact, chesty cough, rapid breathing, and noisy breathing. The points against this diagnosis, the error did not develop any fever, and error did not seem restless, very sick, and not agitated, and there is no bronchial breath sound noted in the respiratory examination. Next, foreign body aspiration. Error is still in the infancy age. There is no fever, chesty cough, rapid and noisy breathing on inspiration, but there is no history of choking. She is not sinus, and no wheezing, also no dysphagia. For the COVID-19 infection, the points for this is shortness of breath, chesty cough, and history of sick contact. But we know that she need to develop fever, but there is no fever. So I think that is for the differential diagnosis. Also, I can include the viral induced wheezing because she has the history of sick contact with the children, and also have family history of asthma, her uncle, and bilateral bronchi were hurt, but there is no fever.
Okay. Can you go for the OSCE?
Okay. For the OSCE, a 7-month-old Malay infant presented to emergency department due to fever and rapid breathing on the day of admission. The temperature documented was 38.5 degrees Celsius. In respiratory examination, there was subcostal recession noted on inspection. The patient also has rapid and shallow breathing. The chest movement was reduced on the right side of the chest. On auscultation, bronchial breath sound was heard with coarse crepitation on the right middle zone. The chest X-ray done revealed right perihilar patchy opacity. What is your diagnosis of this patient? Can anybody want to answer this question? Maybe Shamina?
I think viral bronchopneumonia with bronchospasm because patient had fever, and then there is subcostal recession. There is also rapid and shallow breathing, which suggests bronchospasm. And there is also bronchial breath sound heard and cross crepitation. And the chest X-ray also reveals the right perihilar patchy opacity, which suggests pneumonia.
Okay, yes, that is the correct answer because the fever is high grade fever, 3.5 degrees Celsius. Usually bronchopneumonia, we have the early sign of high grade fever. So rapid breathing.
What is the clue here for pneumonia?
What is what? I don't.
Yeah, the important clue for pneumonia.
Is it important too?
No. Something, if you miss, you are still confused. Breath sounds are very important. This is bronchial. If you found bronchial breath sound, then you are speaking about pneumonia. Otherwise, it is vesicular one. Okay. How does it look? Anyone knows how to differentiate between bronchial breathing and vesicular breathing?
For bronchial breathing, the expiratory is prolonged.
Yes, and what else? And there is gap between inspiration and expiration. So it will be inspiration gap, prolonged expiration. Okay, it is very important. And it looks, if you need to hear it, as if you are putting the stethoscope over the trachea. So it is in breathing in a tube. So they call it bronchial. But the normal breath sound is breathing through vesicles, which is completely different. Okay? So this is very important. Usually in each scenario, there is a landmark which can guide you. Who can comment on the chest X-ray? Naqib?
Yes, Doctor. Okay, so for the chest X-ray, it says that there is a perihilar patchy opacity, which indicate viral bronchopneumonias, because usually viral will cause will give a diffuse pattern of pneumonia, while bacteria usually is a lobar pneumonia, which is it is at one side only, but if viral is more scattered on the chest X-ray, and then
What about the chest? Is it normal inflation or under or over?
For the inflation, for bronchopneumonia.
No, I am thinking about the X-ray in front of you.
I think it's the inflation is normal.
Yeah, who agree with him? Shamina?
I think hyperinflation, because the right and left hemidiaphragm is at the same level. It should be the right hemidiaphragm will be above than the left.
Yes, what
So
other?
it is like flattened hemidiaphragm.
Yes, what other clue? One more? You must count the ribs. How many ribs? Normally it is around 8. So if you count, you will find 8 more than that. 1, 2, 3, 4, 5, 6, 7, 8, 9 plus. So it is very important. Number 1, the chest looks hyperinflated itself. Number 2, the ribs looks like transverse, not like this. It is transverse. And the number of ribs are more, okay? And the copulae of the diaphragm instead of the right is higher by 2, they are now on the same side. Okay, so it is very important to be able to comment on that. That's why sometimes it is confusing even between viral bronchopneumonia and the bronchiolitis. But you need to read the pediatric protocol to be able to differentiate between both of them. Okay, continue.
There is the end of the presentation.
Sorry?
There's the end.
I cannot understand you. You don't.
There's no other mosquito question.
Slide. Okay. Do you have any question?
Doctor, regarding the number of ribs, because we look for the posterior ribs, doctor, to look for sign of hyperinflated lung.
Yes. This is number 1 like this. This is like this.
There's a clear line how many ribs present?
Normally 8. Around 8. In the medium.
Okay, doctor. Thank you.
Any other question?
Sorry, doctor, and not regarding this case, but regarding our case write-up, how can we submit it to you?
Okay, just you can drop it either to the pediatric clinic or to the. Are you allowed to come out or not? If not allowed,
As for now, cannot.
even for the campus?
No, we need to be in our room.
Okay, you can send it to me as a soft copy and they make a form that this case is your work, generic work, and it is not picked from any other source, and they make your sign, okay?
Okay, should we send it to you as a group or individually?
If you collect all in one file and send it to my
Okay.
email,
Okay.
just ask everyone to upload it, but he must write that one and keep also the hard copy in case requested. Okay.
Okay. Okay.
Okay. Thank you.
Thank you, doctor.
Thank you, doctor. Waalaikumsalam.
Thank you, doctor.